Welcome back to Zen Zone Health, your go-to for reliable and easy-to-understand health information. Today, we're diving into a topic that's incredibly important for women of all ages: ovarian cancer. Now, you might have heard ovarian cancer being called the silent killer, and there's a reason for that. Unlike some other cancers, the early symptoms of ovarian cancer can be pretty subtle and easily mistaken for other, less serious conditions. That's why we're here today, to break down those symptoms so you can be informed and proactive about your health. Trust me, recognizing the signs early can make a world of difference when it comes to timely diagnosis and treatment.
Let's talk about bloating for a second. It's something we've all experienced at one point or another. We've all been there, that uncomfortable, sometimes painful feeling of fullness in your abdomen. It can be really frustrating and even a bit worrying. Maybe you had a big meal, or maybe it's just that time of the month. These are common reasons for bloating, and usually it goes away on its own. But here's the thing, when it comes to ovarian cancer, bloating isn't your typical occasional discomfort. It's a different kind of bloating that you shouldn't ignore. We're talking about persistent bloating, the kind that just doesn't seem to go away, no matter what you do. It lingers and becomes a part of your daily life. Imagine feeling constantly full, like you've just finished a Thanksgiving feast. Even if you've barely eaten anything, it's not just uncomfortable, it's concerning. Your clothes might feel tighter than usual, and you might even notice some visible swelling in your abdominal area. This isn't just a minor inconvenience. Now, I know what you're thinking. Bloating is a common issue, right? And you're absolutely right. But there's a difference between occasional bloating and something more serious. But persistent, unexplained bloating, the kind that hangs around for weeks and doesn't seem to have a clear cause, that's when you need to pay attention. It's your body's way of telling you something might be wrong. It could be a sign that something else is going on, and it's always better to err on the side of caution. If you notice this kind of bloating, don't hesitate to talk to your doctor. Early detection can make all the difference.
Now, let's talk about another symptom that shouldn't be ignored: pelvic or abdominal pain. Again, we all experience aches and pains from time to time, but persistent or recurring pain in these areas, especially if it's unexplained, warrants a conversation with your doctor. Imagine this: a dull, aching pain in your lower abdomen, almost like menstrual cramps, but it's not your period. Or maybe it's a sharper, more localized pain in your pelvic region. For some women, this pain might even radiate to their lower back. The key here is to pay attention to the frequency and severity of the pain. Is it a constant ache, or does it come and go? Is it mild and manageable, or is it so intense that it disrupts your daily life? If you're experiencing persistent or worsening pain in your pelvic or abdominal area, don't brush it off. It's always best to get it checked out by a healthcare professional just to be safe.
Chapter 3. Difficulty eating or feeling full quickly. A subtle but significant sign. This next symptom might seem a little surprising, but it's one that many women with ovarian cancer report experiencing. Difficulty eating or feeling full quickly. It's not just about feeling a bit off. It's a persistent and troubling sensation that can disrupt daily life. You might be thinking, really? How can that be related to ovarian cancer? It seems like such a minor issue, but it can be a significant indicator. Well, when a tumor grows in the ovary, it can actually press on the stomach and intestines, making it difficult to eat a full meal or even keep food down. This pressure can cause a range of digestive issues that are often overlooked. Imagine this: you sit down for dinner, but after just a few bites you feel incredibly full and uncomfortable. It's not just a one-time thing, it happens consistently, making meals a challenge. You might even experience some nausea or indigestion. These symptoms can be persistent and can significantly affect your quality of life. This feeling of fullness can be so intense that it makes you lose your appetite altogether. It's not just about not wanting to eat, it's about feeling like you physically can't. You might find yourself eating less and less, even if you're not trying to lose weight. This can lead to unintended weight loss and nutritional deficiencies. If you notice a significant and unexplained change in your appetite, or if you're constantly feeling full after eating only a small amount, it's essential to bring it up with your doctor. Early detection can make a big difference, so don't ignore these subtle but significant signs.
Chapter 4. Frequent urination or urgent need to urinate. Don't dismiss changes in your bathroom habits. Last but not least, let's talk about another symptom that might seem unrelated to ovarian cancer: changes in your urinary habits. Now, I know nobody likes to talk about bathroom stuff, but trust me, this is important. It's something we often overlook or feel embarrassed to discuss, but it can be a crucial indicator of our health. Just like with the other symptoms we've discussed, it's all about noticing any unusual or persistent changes. Keeping track of these changes can help you and your doctor understand what's going on. Imagine this. You find yourself needing to urinate more often than usual, even if you haven't been drinking more fluids. This can be confusing and concerning. You might even experience a sudden, urgent need to go, the kind where you barely make it to the bathroom in time. This urgency can be alarming and disruptive to your daily life. This urgency can be especially bothersome at night, disrupting your sleep and leaving you feeling exhausted. Nighttime trips to the bathroom can affect your overall well-being and energy levels. Now, I know what you're thinking. Frequent urination can be a sign of many things, like a urinary tract infection. And you're absolutely right, it can also be related to other conditions like diabetes or bladder issues. But if you're experiencing these changes in your urinary habits and they don't seem to have a clear cause, like an infection, it's crucial to talk to your doctor. Don't ignore these signs or assume they will go away on their own. It could be a sign of something more serious, like ovarian cancer. Early detection is key, and discussing these symptoms with your healthcare provider can lead to timely and potentially life-saving interventions.
And there you have it. 4 ovarian cancer symptoms that every woman needs to know. Remember, these symptoms can be caused by conditions other than ovarian cancer, but if you experience them regularly or if they worsen, it's crucial to see a doctor. Don't hesitate to advocate for your health and ask for the tests you need. Early detection of ovarian cancer can significantly improve treatment outcomes, so staying informed and proactive is key. Thanks for watching Zen Zone Health. Don't forget to like, share, and subscribe for more health tips and information.